Hello and welcome to our presentation of our training report. This is an overview of how our presentation will unfold. Firstly, with an introduction of our case study, then the key physical and mechanical demands, the proposed training plan, monitoring practices, the coaching considerations, and finally a summary. I will be introducing our sport, highlighting the age, gender, and level of competition that we are focusing on. I will then detail the key physiological factors and key injury risk factors of the sport. To begin, let me introduce you to our case study. We are working with an under-17 South Australian Premier League netball team of females who are training in their pre-season at the moment. Netball is a very popular sport that consists of 4 15-minute quarters played on a court with a size of 30.5 by 15.25 metres, and that is split into thirds. There are 7 players on the court at one time, with each player presuming a specific position that determines their location and main tasks on the court, varying from offensive to defensive. The players in this team range from ages 15 to 17, therefore they are still in school. However, being a state team, they are quite competitive and require significant training and game time commitment. Within this pre-season, they are required to attend multiple court, strength and conditioning sessions in a week, as well as a game on Saturday. In the previous season, several ankle and knee injuries have occurred due to a lack of knee and ankle stability as well as poor dorsiflexion. The team are current reigning champions and look forward to another successful season. I will now detail the key physiological and mechanical demands of these players. Netball consists of very diverse body types due to various positional requirements. Within an under-17s team, it's evident that height is usually an advantage as the average height is 1.69 metres. A healthy BMI is also favourable, as an average of 22.7 is shown. All 3 energy systems are used throughout a game, as players are required to perform repeated bursts of medium to high intensity play followed by rest periods. Various forms of strength are also required, including strength endurance, speed strength, and general strength. Another factor crucial to netball players is agility, as they are required to respond to the movement of players and the ball. Netball consists of short, maximal efforts followed by spurts of rest. However, the length and rest and intensity of efforts depends on the specific position. An average work-to-rest ratio of 1 to 5 can be applied to all positions. Hence, a sound anaerobic system must be developed to provide players with the ability to produce these intense efforts. The prevalence of these high-intensity efforts is evident in that an average player sprints 550 metres in a game, with the average sprint lasting 1.4 seconds. Mid-court players will often produce longer, less intense efforts, followed by little rest, whereas the goalkeeper and goal shooter will produce very high-intensity efforts for very little time, followed by significant rest periods. Netball also requires significant aerobic fitness. This is necessary to firstly recover from the high-intensity efforts more efficiently. However, it is also necessary to ensure appropriate performance over the 4 15-minute quarters of the game. Studies show that the average heart rate of a 20-year-old netballer in a game setting is 174 beats per minute. And a 17-year-old's may only be a little lower than this, meaning they are working in an average of 75 to 85% of their maximum heart rate through a game. Therefore, they're using their aerobic system most of the time. Mid-court players will not always have time to rest, therefore must rely on their aerobic system to keep them performing well. Another study into the physical requirements of netball players by position shows that mid-court players have much better results in a 30-15 cardiorespiratory test, with an average value of 18.5 compared to an average of 16.8 in both defensive and offensive positions. Strength in many forms is required in netball, including strength endurance to sustain repeated muscular contractions such as passing the ball, speed strength to jump high, and general strength to fight for position with other players. Agility is also a vital skill in netball, not only to efficiently dodge around players and quickly change direction when reaching for the ball, but to reduce the likelihood of injury, especially within knees and ankles. Now I will speak more about the key injuries and their associated risk factors. The most common injuries in netball are associated with ankles, knees, and fingers. The key risk factors that can cause these injuries are the hard court surface, rapid deceleration, poor landing mechanics, quick changes of direction, and physical contact with other players. The most common injuries occur within the ankle region. More specifically, the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. The stop-start nature of netball, poor landing mechanics, and quick changes of direction are the key risk factors here. These injuries are more often seen in netballers over soccer or AFL players, as they are not allowed to step with the ball, meaning they must suddenly stop. The rapid deceleration can lead to twisting and bending of the ankle, causing these injuries. Within the knee, the most common injury is to the anterior cruciate ligament and the meniscus. The ACL is the tissue that connects the femur to the tibia and is one of the most dreaded injuries in netball, as it often requires surgery and months to fully heal. The cause of ACL injuries is similar to ankle injuries, as it includes the rapid deceleration and poor landing mechanics. Studies showed that the most ACL injuries occur within the mid-court players and in the first or last quarter of the match.
Hi, I'm Molly. I'm going to be talking to you about the training plan we've designed for the team to elicit the best physiological responses for a successful start to the season. Leah has rounded up some great information about our athletes. With this information, we've been able to create a periodised training plan. The model that we have chosen mimics the traditional model, which utilises a wave-like increase in intensity and volume with relatively limited variation in training means and method. We've chosen this method due to the age and experience of our athletes. The average age of our netballers is 16 and a half, and they have indicated that they have only in the past 6 months or so begun resistance training as a part of their netball training structure. So in order to monitor fatigue, ensure they're using the correct technique and best prepare our athletes, we've chosen this model. We've manipulated the training intensity and volume in the mesocycle, with week 1 being a shock week. A shock week has a 20 to 30% higher training volume, with the aim to load athletes with high intensity that mirror the start of the season and to promote large games in a short amount of time. After shock week, athletes will have high levels of fatigue, which is where 2 weeks of general training and training intensity and volume will occur. Here we will monitor to make sure to protect our athletes as best as possible from injury risk and overtraining, with intensity over both weeks 75 to 80% and volume remaining at the 70% level. Following weeks 2 and 3, we've planned a deload week. A deload week sees a reduction in training volume by about 30 to 50%. Intensity and weight in resistance sessions will remain high because we're looking to maintain the strength within this week. We are just manipulating sets and reps. The deload week enables the body to recover from previous training sessions and weeks. Ideally, our deload week is scheduled at the latter end of the mesocycle to allow for supercompensation for the upcoming season start. This is the microcycle taken from our week 2 pre-competition mesocycle. Going from the information that Leah has given us about netballers, we know that they are very versatile athletes and require all 3 energy systems in a game. Our pre-competition training block trains all aspects of these energy systems whilst incorporating them in a game setting in preparation for the season start. Preceding this cycle was a conditioning emphasised phase which focused on the aerobic and anaerobic conditioning with small bouts of skill. This pre-competition phase, being closer to the season beginning, is more skill focused, so we've dedicated 2 court sessions with conditioning on either side to elicit game specific fatigue. 1 resistance session with a different focus each week. For example, this week we're focusing on general strength, but week 3 focuses on plyometrics. We've also got 1 pre-season game on the weekend which will be replaced by the competition start. 1 testing session to monitor our athletes' progress, important coming into the weekend's games, and after our testing session on Fridays, we'll have a coaches meeting, which is where team selection will occur, checking in with our athletes' physical and mental state, and to speak about any other concerns coming into the weekend's competition. Recovery has been scheduled after the weekend game to ensure that recovery begins as soon as possible after high intensity efforts, so that our resistance session on Monday can be done at best quality recovery. We have taken a few things into consideration when planning our periodised plan. We are aware that our athletes are still of school age and may potentially not have access to their own transport. So all but 1 of our weekday sessions are after school, which makes carpooling and public transport that little bit more accessible and safe. With our netballers being at a competitive level for their age, we've also made a conscious effort to create enough variation in the week to avoid monotony. Along with this, we're also conscious of other commitments such as schoolwork and work, so we have kept one night in the week free to encourage full attendance to our prescribed sessions. We've chosen to focus in on a couple of sessions to explain our rationale for exercise selection. Week 2 of our resistance training sees us in the gym focusing on general strength for our athletes. Aims of this session are to improve general strength and hypertrophy, improve dorsiflexion and incorporate strength endurance towards the end of the session. We would like our athletes to be working at 85 to 92% effort, so we have included an effective warm-up. Our warm-up is split into 2 sections, a general warm-up to get the core body temperature up and lubricate joint structures. The second section will be movement specific, including compound movements to complement this activity-specific movements and prepare the musculoskeletal tissue. This 2-phase warm-up system helps us reduce the likelihood of injury while potentiating the neurological system. The warm-up is then finished off with a cognitive engagement drill to get everyone firing and smiling for their upcoming session. This here is our resistance training structure. We have identified we'd like our athletes to be working at 85 to 92.5% of max effort to elicit the desired general strength and hypertrophy outcomes. You will notice here we have chosen to train large muscle groups at the beginning of the session while making our way down to smaller muscle groups in calf raises and dead bugs. In order for athletes to have the most effective outcome in this session, designated rest periods are of utmost importance. For our barbell exercises, we have included a 2 to 3 minute rest break, depending on the level of fatigue and readiness to commence the next set. The method we have used for selecting rep range is based on the age and experience of our athlete. As we have previously mentioned, our athletes have only recently started using resistance training. So we have chosen the Reps Plus method to identify both the appropriate load and rep range for general strength and hypertrophy. Our first set for barbell exercises will be bar only with an 8+ rep range. If there are athletes who are able to easily complete the 9 reps at this weight, we will encourage them to increase their weight by 2.5 to 5%. If there are athletes that struggle to complete 8 reps with correct technique, we will adjust the load accordingly. Calf raises have been selected as a lower body exercise to improve dorsiflexion. Depending on the previous screening results, athletes will perform single or double leg elevated calf raises at a controlled pace for an enhanced contractile efficiency. The rest given for both calf raises and dead bugs will elicit a strength endurance outcome. This stresses these small muscle groups and allows limited recovery between sets and encourages lactic acid tolerance.
We have intentionally placed our conditioning sessions with our court sessions, due to us being in the latter stage of pre-season. We want to elicit game-like fatigue conditioning. This phase is also building from the phase before, which was predominantly focused on aerobic and anaerobic conditioning, with limited focus on skills and ball work. By incorporating our conditioning sessions with the court sessions, this will stimulate the athletes in a game-like scenario, as well as anaerobic and aerobic conditioning. We have separated our conditioning sessions into anaerobic and lactate sessions and one purely aerobic session. The aim of our anaerobic and lactic conditioning sessions is to improve anaerobic capacity, promoting anaerobic glycolysis, improve speed, improve deceleration and eccentric muscle contractions, and to simulate position-specific movements and distances. Tuesday's conditioning session is occurring before our court session, as we want our netballers to have their least fatigue state to be able to complete their session at a high intensity. Much like we have stated earlier, we have a court-based warm-up which will ready the netballers to begin their conditioning session at a high intensity with their core body temperature raised, their muscle activity increased, and their joint structures lubricated. For anaerobic conditioning to be effective, athletes need to be working at 85% or higher of maximum heart rate and be given ample recovery to repeat the drill at high intensity. For this session, we would divide the team up into positions and with the mid-court players lining up on the baseline, goal attack and goal defenders will line up on either side of the red line, and goal shooters and goalkeepers will line up on either side of the blue line. Each position will be running at a different distance that replicates the intended game-light stimulus. The mid-court players are sprinting the full length of the court, 30 metres. The goal attack and goal defenders are sprinting 2/3 of the court, 20 metres, and the goal shooters and goalkeepers are sprinting 1/3 of the court, which is 10 metres. It will take each positional group a different time to get to the end of their line, but we are looking at a work-rest ratio of 1:5 to 1:20. The official 30 seconds rest period begins when the mid-court players have reached the end, which will elicit a 1:5, 1:7.5 and 1:15 rest ratio, all of which allow restoration of ATP. We will repeat this drill 25 times with the maximum amount of work completed by the mid-court players of 2.5 minutes. With there being 25 rounds of the drill, it will take 15 minutes, which is the equivalent to 1/4 in netball. There will be time for players to have a drink and 3 to 5 minute break before starting with the court session.
Hello, I'm Zelda, and I'll be talking about how we'll be monitoring our team's progress and what we will implement to assess their developments. Within netball, a successful team directly correlates to their ability to maintain and improve their fitness, strength, agility, speed, and decrease the risk of injury. Our aim is to accurately monitor those physical characteristics that are crucial to a netball team's success. It is important to note that this and all the testings will be individual and only judged by their position in court and what that position requires. It has already been stated that mid-quarters must predominantly rely on their aerobic system. They have significantly fewer rest periods within the game compared to defensive and offensive players. Therefore, as stated again, mid-quarters are required to have greater cardiovascular endurance than goal shooters, goalkeepers, goal defense, and goal attacks. This means that fitness testing is already hypothesized that the centre, wing attack and wing defence players will have higher scores in the cardiorespiratory tests. Firstly, I'll be talking about the fitness tests that our athletes will do in week 1 and week 3 of our macro cycle to monitor their improvements in their speed and endurance. This test will not be done in week 2 and 4, as week 4 is a deload week, and we believe performing this test each week will not give us major improvements on paper. The week 1 and week 2 fitness test that the athletes will do is the Yo-Yo Intermittent Recovery Test Level 1. This has been chosen because of its ability to track an athlete's growth in recovering from and repeatedly performing high-intensity efforts. There was a debate between the yo-yo test and the beep test. However, the beep test involves continuous shuttle running to the timing of beeps that steadily increase. It is not as relative to the game of netball when comparing it to the yo-yo test. Like the beep test, the yo-yo test is set up by having cones 20 metres apart and performing by following audio cues that dictate the running speed. The difference between the two is that the yo-yo test allows for a 10-second rest between each 40-metre running interval, which is more sport-specific to netball as each position has multiple rest periods within a game before performing high-intensity efforts. The change of direction within the test is another physical characteristic that netball athletes need to be advanced in. Professionals in the sport state that mid-quarters should push to a level of 18 and above in the yo-yo test. However, this level will not be a requirement for our mid-quarters, but simply indicates that the mid-quarters are expected to reach higher level than defensive and offensive players. Testing lower body strength is another important assessment, as a study done by Thomas et al. 2017 demonstrates that athletes with higher relative lower body strength have significantly faster sprint times.
This can be explained by having higher levels of strength produce greater acceleration and deceleration during jumping, sprinting, and changing direction. Our athletes will be having weekly tests of a vertical jump, testing both legs individually as well as together. The vertical jump tests the athletes' muscular power, and testing the legs individually can also provide an indication of risks of injury. Muscular imbalances within the hamstring to quadricep ratio and imbalances between each leg are mitigating factors to ACL injuries because one side is often overworked. The results from the single leg vertical jumps can show those imbalances and allow us to tailor a strength program to improve and even up those imbalances. When properly monitored, this test can also aid in training them the proper jumping and landing technique, as well as strengthening their ankles and knees. Another strength test that we are using is maximum push-ups to a tempo. The aim of this is to monitor their upper body strength endurance. We chose push-ups because of the muscles used within the movement: pectoralis major, pectoralis minor, deltoid major, and minor. These muscles are used frequently within the game when chest passing, shoulder passing, bounce passing, etc. The test will be done by having all our teammates in a push-up position, which, relative to their own strength, can be performed from the knees or on their toes. We will then ask them to all start at the same time and perform push-ups to a tempo of 3 seconds in the eccentric phase and 1 second in the concentric phase. They will go until their own maximum amount. Other tests we will apply to our schedule have more to do with stability. The knee to wall test and standing on the Bosu ball on one leg for maximum times are the two tests that we will do. The aim of the knee to wall test is to examine our athlete's calf flexibility and assessing ankle dorsiflexion range of motion and ankle mobility. Our athletes have a history of poor dorsiflexion and general stability, which led them to having knee and ankle injuries. Having good dorsiflexion, especially when playing a sport that involves a lot of running, puts your foot in a good position to absorb the force when the foot hits the ground. Without the proper absorption of force, injuries can occur within the ankle and knee because the athletes are compromising their jumping and landing mechanics and their running technique. The test is done against a wall and only requires a tape measure. The tape measure is placed on the ground and positioned so we can measure how far a foot is away from the wall. The athletes will get asked to have their foot in line with the tape measure and then lunge forward until their knee hits the wall while their heel is still positioned on the ground. We will measure how far their foot is able to be from the wall to have their knee touch the wall and their heel on the ground. The measure will start at their toe. Balancing on a Bosu ball single leg for a maximum time is an assessment that we believe to be important, as within a netball game, having great balance and control of their centre of mass is crucial when catching the ball mid-air and landing on one foot, or within the goal circle and having to shoot a goal on one foot. The Bosu balancing ball resembles half Swiss ball with a solid plastic base, and balancing on it produces ankle muscle activation, which when performing the exercise repeatedly can strengthen those muscles. A study performed by Londa & Co. 2010 state that repeated efforts on balancing on a Bosu ball can significantly reduce the likelihood of ankle sprains, as well as improve their overall athletic performance. The test will be done by having our athletes have one Bosu ball between two, so that while one person is performing the test, the other can be timing them. They'll be balancing on a solid base first, on their left foot and then on their right. After one person has completed both legs, they will swap positions. The results will be documented. Lastly, I want to touch on how we will be documenting everything and also having our netballers monitor some of their progress intrinsically. Firstly, we'll be using this table to document our players' improvements. This table will not be openly shown to all players and only be used by us to assess how they're improving. We will also use this table to have a one-on-one conversation with each player during our meeting times to discuss their own improvements and how they feel they are going. Lastly, I want to touch on how we will be documenting everything and also having our netballers monitor some of their progress intrinsically. Firstly, we'll be using this table to document our players' improvements. This table will not be openly shown to all players and only be used by us to assess how they're improving. We will also use this table to have a one-on-one conversation with each player during our meeting times to discuss their own improvements and how they feel they are going.
Hi, I'm Molly and I will be explaining the coaching considerations for our under-17s netball squad, as well as summarising the report. Safety requirements. Coaches must be aware of each player's current injuries and history to adapt training requirements for specific athletes. As we are aware of several ankle and knee injuries from previous season, landing mechanics as well as ankle and knee stability are some of our focuses for the pre-season. Physical limitations can be determined by genetics such as height and limb proportions, and may also be acquired through life events, injuries, and training. These physical limitations must be considered to ensure effective training. As our players are 16 to 17-year-old females, most of them have stopped growing and have similar capabilities of adult females. However, the training age in terms of strength and conditioning may vary amongst players. Technique may be altered to each athlete's physical limitations, such as allowing turned out feet during squats to allow correct knee position, or allowing athletes to choose between bilateral or unilateral calf raises, depending on ability. As for environmental safety considerations, Premier League netball teams play on indoor netball courts with sprung wood flooring to allow maximum support for players. These courts are also used for training to mimic gameplay as well as prevent injury. An indoor weights room is used for resistance training sessions, where safety requirements such as adequate space between players and correct technique are explained before sessions. Regular drink breaks are given during training sessions to ensure players are well hydrated. Athlete health and well-being. Stress from school and personal life can negatively affect athlete performance during training. Therefore, training has been scheduled to accommodate school as well as time for homework and other commitments. Adequate sleep is required for recovery and to prevent stress. Therefore, training is scheduled to allow athletes more than 12 hours between training blocks to rest and recover. Eating disorders are more commonly found in female athlete population than the general population. As these athletes are at a crucial stage of their psychological and emotional development, education surrounding diet as well as mental health should be given to athletes. Coaches should be aware of signs of eating disorders and other mental illnesses, as well as encouraging players to track their sleep, eating habits and mood to maintain health and well-being. As these athletes have been selected for the Premier League team, being 16 to 17-year-olds, we can assume that they have been playing netball for between 5 and 8 years. Yet many of these athletes may be less experienced in a gym setting, as well as less experience taking responsibility for their own health and fitness outside of training. However, as we are specifically focusing on the last 4 weeks of pre-season, we can assume that all players are at the autonomous stage of learning for gym skills and of course court skills. Autonomous stage of learning means the skills are reflex-based within the athlete's neural circuitry. Therefore, feedback can be given during reps, with more detailed feedback after each set. As the under-17s team have an experienced training background, Skills that they are developing during pre-season are merely additions to previously acquired skills. Coaching feedback should be clear, constructive, immediate, and specific. Positive reinforcement and praise is necessary to keep players engaged and motivated to improve. As stated during our report, netball requires the use of all three energy systems. Therefore, the aims for our under-17s pre-season are to improve general strength, speed strength, and strength endurance, as well as increase aerobic endurance to sustain a high performance throughout the duration of the game. A focus on landing mechanics, ankle and knee stability is necessary to ensure injury prevention during the season. The training plan is catered around the athlete's school commitments as well as allowing enough time for recovery and leisure time. Progress is monitored using the yo-yo test and vertical jump test to ensure progress and prevent over or undertraining. Athlete well-being is of high priority, as psychological and emotional stress of athletes can inhibit their performance and heighten arousal levels in an already stressful game. Surveys to track sleep, diet, and mood are used to monitor athletes' well-being, and coaches are aware of signs for poor well-being. Thank you for listening to our presentation.